Y'all just don't know how nervous I am, though. And people walking by. And... Anyway, okay. Hi, my name is Rita Echols. I work at the South Haven Surgery Center. In 2006, I worked at another company, and it just felt like that my hip needed to pop. Then when I came to work here, I was seeing a chiropractor, and he told me that that wasn't going to help me any, that I really needed to utilize the doctors that we had here.
I'm Ross Bailey. I'm a joint replacement specialist here at OrthoSouth. Rita had a pretty significant bone-on-bone arthritis in her hip, and the way that your hip is designed, it's a ball and socket joint that is supposed to glide and move smoothly. With arthritis, you lose that cushion and things grind and click and pop and hurt instead of gliding like it's supposed to.
Well, being in pain is no fun. My husband would probably say, yeah, it did affect my mood.
So we went over options, and ultimately together we decided to do an anterior hip replacement. There are multiple ways that you can replace a hip, but an anterior hip replacement is my favorite surgery of all the surgeries out there. I make a small incision on the front of your hip. It's 4 to 5 inches long. I don't cut any muscles, work between the muscles down to that damaged ball and socket joint. Give you a new ball and socket that's able to move and do the things that it's supposed to. I get you up walking after surgery, usually within about an hour.
I didn't have any problem being treated here. I knew the people here. I knew they would take good care of me just like they do the other patients. They make them feel like family. I did feel well informed because, he showed me exactly what would take place, implant that would go in there, how it would look. Allie was my pre-op nurse, and then Abby was my post-op nurse. Allie prayed with me before my surgery. Abby prayed with me while I was recovering. Abby even called me later that day. Even Lane from anesthesia called me later that day to check on me. They kept in touch with my husband to find out how I was doing. Well, I had the mindset before I had the surgery that I was not going to be, that I had to make myself get up, that I couldn't be sedentary, because if I did, then that was just going to make it worse and make the recovery longer. I was actually up that Friday night walking through the kitchen with my walker. I actually got out of bed, went to the den, laid on the couch, got up from the couch, went back to the bed. My name is Rita Echols, and I had my surgery on April 3rd of this year, and I came back to work in 3 weeks.